hospitals, and as soon as we are ready, we are going to indicate. And we are saying this in advance so that communities are aware that at some point we are going to be sending them to centers that are outside of our normal hospitals, but those centers would have been fitted and properly placed to be a hospital. So we will indicate when those centers are in about a week or two, once we are ready and we know when we are going to be utilizing that. So that was the meeting that we had with the minister, just to update him on the different number of issues that we had. Of course, the minister also became part of our meeting. If you remember that in the media briefing that we had with the Premier of KwaZulu-Natal, I had indicated that on Monday, which is next Monday, we're going to have an engagement with the CEOs of the different private hospitals in the province. We decided that Monday was a bit late and we brought the meeting forward. So this morning we had a meeting that was, well, we had a visual meeting with all of the hospitals that are functioning or are operating within the province of KwaZulu-Natal. And we must say that where we have bigger groups, we had more than one participant, and it's something that we really appreciated because it then clarified the different roles that we as government must play and the roles that the private sector plays itself. So that meeting was really just meant to clarify that. It was meant to clarify the protocols that must be followed and adhered to by the private sector in relation to the management of the cases that we get, and the established relations on how we engage in relation to information sharing between the private sector and us as government. So that meeting was a meeting that went very well, and we established a number of other protocols of engagements moving forward, including at a technical level, where the head of department of KwaZulu-Natal will be engaging with the different hospitals, and we agreed that we are going to establish one common platform where all the hospitals are going to engage on, and that platform will include the different groups, because the private hospitals that we have in the province, some belong to groups, but others they are just individual hospitals. So we will establish one platform that will be responsible for that. And instead, as of Monday, we will then go to have that engagement with the different private sectors. I must indicate that we have been having a number of offers as well from the private sector who are offering us the usage of their different beds, and we are negotiating and trying to find the nature of agreement that needs to be entered into between ourselves as government and the different facilities. So in essence, colleagues, that was our day today. Immediately after that, the minister also has a number of other engagements today. We also have a meeting that we are going to have with our own provincial war room that is responsible as the Department of Health in ensuring that we are running this response to the outbreak or to the pandemic of COVID-19 in the province of KwaZulu-Natal. Let me then head over to the minister, who will then take us through the briefing. Dr. Mkhize.
Thank you very much, MEC, HOD, and senior officials, and thanks to the members of the media and the public. Firstly, let me just start with the meetings that were held with the MEC and the KwaZulu-Natal Health leadership. Yes, indeed, there were two aspects of the meeting. One was the briefing in relation to the readiness of the province. I'll come back to that a bit later. But the one issue that I was quite happy to join was the meeting with the private sector. Now, the leadership of the private sector who were here were not only about those who are in KwaZulu-Natal, but they were also group leaders and therefore national leaders. In other words, some of the group leaders, CEOs of the private hospitals across the country, and some were also representing the Hospital Association. I think what's important as we sit here was the fact that there are specific issues which were of concern, which we were to deal with in this particular area. And we were, whilst looking at KZN issues, but also the opportunity to share issues in broad terms about our relationship with the private sector. The starting point is to say that the way we are responding to the outbreak pandemic is that we treat ourselves as the health sector. Actually, both public and private have to operate as one team. That means, therefore, our coordination and our communication has to be always very open, and that we must be able to deal with issues quickly. I pointed out to the leaders that it's important for us to make sure that we approach the outbreak in the same way, and that any lapse on any one of us is actually going to be a flaw in the entire outbreak response. And therefore, it's no longer, it doesn't matter whether it's public or private, we've got to do the same thing, we have to do that properly. So it was important that all the private hospitals have to adhere to the standard operating procedures and also follow the clinical guidelines that are given by the NICD, which is basically our institution that guides everyone's response in this case. So everyone is actually obliged to follow those protocols, particularly as it relates to the infection control and prevention of the spread of COVID-19. I think that point is important because there are a number of issues that have raised, that have caused us serious worries as we looked around. Firstly, I have had complaints that come from a number of other staff members sometimes and that are in the private hospital. And so I made it quite clear that when we get when we get complaints, they may not have been known by the management, but the health department will step in and investigate whatever is being raised, and therefore we don't need the authority of the private hospital to investigate. Our management, our disaster regulations mean that there's authority to step in of government. Our role here as government is twofold. On the one side, we are the service provider. On the other side, we are the regulator. And therefore, when there are complaints, we step in. And therefore, when we do so, we don't necessarily need to be given authority by the private institution to step in. It's also important to know that the compliance is expected from all of the institutions that are approached, and that compliance means that it is mandatory for the private hospitals to offer whatever support, information, and cooperation that is expected. And of course, we have an agreement with everyone that everyone is willing to work together, cooperate, and I like the spirit, and therefore I think it's important for us to say the meeting went very well. We also had to highlight a number of areas. For example, there have been concerns about a number of hospitals. Last week, I had received a letter to the MEC to actually send a team to look at the hospital, private hospital in Ladysmith, which was done. This week, we raised the issue of St. Augustine's. The main concern in that area has been the numbers of deaths in that hospital. But I've also had other concerns where I've asked that they must go and monitor, and that's like private hospitals, one in Hibiscus Hospital, the other one is in Parklands, the other one is Shifa Hospital. These are being monitored specifically because there have been certain instances here where we've spotted some of the cases, and there are certain things that we need to do. Amongst those issues, just to make sure that there is good enough awareness, because as we're looking at St. Augustine, it became important to say this awareness on these issues. We need to make sure it's standardized. One of the weaknesses in the private sector is that sometimes there are staff who are not fully employed, who are moonlighting, so there might be a break in the chain of information flow when it comes to that. So that is an issue therefore that we look at. So far as St. Augustine's is concerned, I have received a report from the provincial department. I've also received, I've actually communicated with the leadership of Care to find out if there actually be good compliance. I can state that the St. Augustine's Hospital has now been closed. It's been closed a few days ago, and the closure means that there are no pay-in, there are no new outpatients, all the sections are not operating, and the numbers of the wards are closed, and therefore the fumigation process has started as was ordered by the Department of Health. And there is a section that we've allowed that they must keep open, which is detached from the main section, and it's mainly because they've got originally they had 80 patients. They've now the numbers have reduced to 58 patients. Those patients can't be moved to another hospital. Firstly, the number was high, but secondly, the hospital must begin to contain the patient itself, because we also wanted them to create a unit that begins to look at what we call PUIs, as patient under investigation. Those are people that we need to exclude the existence of the COVID-19 amongst them, and therefore that hospital must take care of that itself. And so we've agreed with them on that. So at this moment, I would say that there's not been a problem of compliance in this regard. And I'm also happy that the province has taken all the necessary steps to ensure that there's compliance, that there's effective infection control procedures in them. They had actually tested a large number of people, and at the time I reported 2 days ago, the number was 66 people had been tested, and 48 of them were staff. Now, there's a very large number of staff to be infected in a particular institution, and therefore we've actually asked that the provincial government, Provincial Department of Health, must institute an investigation. Provincial Department of Health must institute an investigation in terms of why, how we ended up with so many people infected in one place, and particularly if it's professional. It's more serious to us, because the first people that we need to make sure that they are safe and protected are the professionals, the health workers, because they deal on a day-to-day basis with the infection. And the fact that their training is to actually contain the infection means that we all should know how to make sure that we can deal with the infection without acquiring infection as professionals. So we want that investigation to make sure we find out exactly what happened. And the leadership of Netcare has been advised that this is going to be happening, and therefore that process is going to be ongoing. We have also indicated as well that the relationship between the public between the public and the private health in this case is actually very important, because they need to pool together the numbers of beds so we know how many beds are available in the whole province, in the whole country. And in this case, those beds, we treat them as beds. We treat them as beds, and it's going to be on the basis of need. In other words, there are patients, largely as you are all aware, the large number of people who are on treatment in hospital, that number is largely in the private sector. Not many are in the public sector, the large number in the private sector. And therefore, their treatment has got to be managed with a similar understanding that we're managing one outbreak. Secondly, at a certain point, when government feels that they need more beds and there might be capacity in the private sector, we'll call on to those beds and make them available to the public sector. We have therefore said that there's a space for collaboration at a provincial level between the public and the private. They can discuss, but there are certain decisions that have to be taken at a national level across the country. For example, the conditions under which the public sector will have to be utilized and the prices that are associated with that are going to have to be discussed at a national level, so that there is no unevenness and asymmetry as we deal with the use of those public private beds. In fact, we should be able as government to determine the price that we're prepared to pay to deal with the treatment of our patients in there. So that issue needs to be dealt with. When it's times of emergencies like this, it needs to be understood that government has an obligation over the whole nation. And I give an example here, which I shared with the team, that in Spain, I found it quite interesting that one day everybody woke up and the government of Spain had nationalized all private hospitals. And they said, until further notice, these are now under our care. So you just need to understand that there is a particular responsibility of the government over the management of existing resources, and that everyone understands. There is no problem at that level. So those issues of cooperation become less of a challenge. We therefore emphasize the need to train the staff on infection prevention, and to make sure that we all follow the necessary protocols. We've also asked that they must identify areas where there might be risks inside the private hospitals and do samples on staff, so that we don't get a surprise of suddenly finding that there's an explosion of so many health workers who are actually positive in the area. And we believe that it's important for us to be able to deal with that. We're now going to be discussing this matter with the various MECs, so that I can keep account of how many health workers are testing positive in any other part of the country, whether in different and amongst the different professionals. So we will be taking that matter at that level. We've also shared with them that already on the private hospitals, there's clear cooperation there. There's no problem, and every now and again I host a meeting with the CEOs of the private laboratories, and they have also agreed that they will cooperate, and they are doing so at this moment, and there's actually no problem. We now operate as just one system. Whether it's public or private, it doesn't work, it doesn't matter, but what we are now saying is that if we need numbers, if we need information, if we need anything, we pick up a phone and call. If anybody's got a problem, if they've got backlogs, with a report, we've got a backlog, we shift them to the government to test, and therefore, at this point, we actually don't have any problem. We have actually emphasized the need for adequate information, because all the provinces are running a challenge whereby we've got a number of unknown or unclassified patients where we're not sure of the patient's details, the province, and that begins to create a difficulty in the numbers. When I say this province has got X numbers, then the provincial leadership says, but we know so many more. And that is because others have not been classified from the point of view of the laboratories. And so we want that issue sorted and removed out of the way. So all in all, I would say that our meeting with the private hospitals has been very fruitful, and I think there's a clear understanding that they will be compliant insofar as all the guidelines from NICD are concerned, that also when there's the role of the government to step in and investigate and monitor, that will be met with cooperation, and that between now and going to the future, we're going to handle this issue together as a common problem, irrespective of whether this is public or private. From that point of view, therefore, I want to say thank you to the MEC for allowing me into the meeting, because I did want to meet with the leaders of the private sector. There will be other meetings, and we'll continue to meet at that kind of level. I also shared with them that we have concerns around the shortage of PPEs. I will also talk about this, because the issue around PPEs means that we have to deal with the private sector on the manufacturing side and the provision of the health commodities and pharmaceutical products and so on. So I'll hold it at that for now, and then say that I was just wanting to say that one of the issues that I wanted to, that brought me into the province, was to get the briefing in relation to the private hospitals, as well as the issue of getting the provincial report on the issue of on the updates, as it were. It's a very special day today, being Good Friday, and I really want to pay tribute to the churches, the church leaders, and all the various congregations for the assistance that they've given in the fight against COVID-19. We do want to acknowledge that it's a special day for the Christian community in particular, and to an extent with the Jewish community on the day of the Passover. It's a very special day in the calendar of the Christians and of course the Jewish community. And we acknowledge that for many people this is happening, and people are in their homes, and that it's a day of prayer, it's a day of meditation, it's a day of commitment, and we wish everyone well on such a special day. But our circumstances have been improved by the way that the communities across the country have handled this matter. So we really want to acknowledge that this is a day where everyone would be out there in their church, they would have been part of the services, they would have been part of a whole long weekend of spiritual upliftment, but people have taken the heed of the president's call and have decided to stay at home. And I really think that on behalf of ourselves as health workers and government in general, it is really something that we appreciate, and we want to say to everyone, it was for a good cause, and as it will be demonstrated as we move on with this briefing, it's really made a huge difference. So I therefore want to move on to mention a few other issues which I think are of interest. I think the most important thing is to acknowledge the leadership of President Cyril Ramaphosa. He made a very strong statement and gave leadership yesterday, and from that point of view, I believe that it's really put our country in a much better position to be able to fight COVID-19. As I go on, you'll be able to see what we're talking about as we deal with that. But before we move on, let me first start by giving you some of the figures. As of today, and maybe let's start by saying, when we give you the figures, we don't give you the figures of this moment. We give you the figures up to 12 o'clock last night, and therefore there will be always a bit of a lag behind these figures, and so that's where we're moving from. At this point, the total number of tests that have been conducted is 73,028 tests, 73028. The number of confirmed positive cases is 2003, and that is as up to the date as I indicated. The total number of deaths has risen to 24, and the total number of, and of course, with the new deaths, we also want to convey our condolences to all the families who have lost their loved ones. We also want to convey our appreciation to the staff who have dedicated their services to caring for all our people, and we want to say that their efforts to help and save our nation will always be appreciated, and they will actually they are always in our thoughts and prayers, and we want to appeal to society in general to continuously give support to the health professionals who are sitting there and are in the forefront of fighting this pandemic. It's a huge pandemic. The whole world is battling, and of course ours are fighting in a very heroic way in reducing the toll, the mortality and the morbidity, and really want to say we're very grateful to all of them. So the total numbers of deaths is 24 people at this point. The total number of recoveries is 410 people. Now, I did indicate to you that these numbers are not going to be rising in 1, 2, 3 kind of linear way. They're going to rise in batches simply because we wait for 14 days and then we wait for certain clinical evaluations, and then we can allow people to be confirmed as recovered, as well as the tests that are associated. In terms of the confirmed cases, I want to say that in Gauteng, right now the total number is 801. Western Cape, the total is 541. KwaZulu-Natal is 412. In the Free State, it's 94. In the Eastern Cape, it's 68. In Limpopo, it's 24. In Mpumalanga, it's 20. In the Northwest, it's 18. In Northern Cape, it's 15. We've still got 10 that are unallocated that we will clear as the day goes. So that's the kind of number that we've got. In relation to deaths, I'll give you the numbers as follows. In Gauteng, we have had 3 deaths. In Western Cape, we've had 6 deaths. KwaZulu-Natal, we've had 12 deaths. In the Free State, we've got 3 deaths. Then the rest of the provinces have no deaths. I do want to explain something here which I think is relevant, although it doesn't change our numbers. You will notice that of most of the people that have reported having passed away, the numbers, I would say 2 of them were, one was 48 and one was 46. Those are the youngest so far. Other than those, the majority starts from age 63 upwards. Now, in most of them, there is recorded concomitant diseases. Now, in other words, these are diseases that pre-existed before the person was actually infected with COVID-19. Now, it becomes a very, because it's a viral infection, we always want to make the point that some of the conditions that people are suffering from could have actually compromised their lives and even caused death in the absence of COVID-19. But once you've got COVID-19, even if you could have, the real cause might have been the underlying disease, we will just record it as such simply because we are pointing out at the fact that there is a correlation with pre-existing disease and an infection with COVID. So that what happens is that once you've now got COVID-19, we know that that complicates the lives, as it were. The one patient we spoke about at stage 4 of prostate cancer, that meant that such a patient could have passed away anytime. Others at thromboembolic phenomenon, others at other underlying pneumonias, and so on, or ischemic heart diseases, etc. So it's going to happen, but what we are seeing is largely that people who have got coexisting diseases tend to be compromised quicker, and that's what the point we want to make. Of the recoveries, we'll give you the numbers again. In Gauteng, 157 people have recovered. In the Western Cape, 152 have recovered. In KwaZulu-Natal, 15 have recovered. And in the Free State, 61 have recovered. In Eastern Cape, 3 have recovered. In Limpopo, 13 have recovered. In Mpumalanga, 6, and Northwest, 3. The other provinces have nothing. So if I can just step off those figures and move to something else, which I hope will make sense to you. I want to go back to the statement that was made by President Cyril Ramaphosa yesterday, that the decision was that there is a need to extend the lockdown. And I think it's important for people to know that there's a lot of support for the decision, and the scientific basis for it is very, very sound, and we are very, very happy that the President has been able to lead us in the way that he has. And we also want to thank President, the Cabinet, the National Coronavirus Command Council, and all the professionals and all the health workers, the policy makers in the various provinces, the research scientific communities, particularly those who advise us, as well as the South Africans in general, because this is collaborative work. We did say that to defeat COVID-19 is no longer an issue of a nurse and a doctor. It's actually about society actually going into a combat zone and fighting this infection. I do want to say that at this point, the indications we have, as President has indicated, are very promising, but we did say before that whilst we see some very promising elements in the response, it's still too early. And therefore, if there's any turn in the events, in the outbreak, we may not have much other warning. So I think it's important for us to keep remembering that we are still traversing through a storm that's gathering, and the storm is not over. However, if we can see that the storm is delaying, I think we need to point out to our people that we can see that the storm is delaying. It still hasn't dissipated. It's just delaying a little bit, and therefore we must know that we can't be complacent. We have to move on. I'm going to bring your attention to the graphs, if you might want to look at the graphs. This graph shows you the pattern of how this infection has gone on in the whole world. I'd like you to go back one slide. Let's go back one slide. That's it. No. Let's go back. No, just check all the slides. That's the one, yes. Now, I'd like you to look at this slide. Today, we are talking about an epidemic that has gone to almost 1.5 million people in the world. But it started let's say January in China. So if you look down there where it started, you will see that the early in January there was the first genetic sequence available on the virus, and then at some point in China started a lockdown. You see where China started a lockdown. That's the second line there, the black line on the left. That's it. Now I want you to follow the red line that shows you how exponentially as the outbreak has exploded in the whole world. It's gone up now to 1.6 or so million people, but if you look somewhere a month and a half later, Europe started to look at lockdowns, and that was sometime in February, and at that point the infection was actually just getting closer towards 100,000 people. And then thereafter you can see that we continued until we got the first 100,000 people, which was early March. And then since then the World Health Organization started declaring it's a pandemic. By then 28 countries were affected, and then at this point just over 200 countries are affected. But there's a huge and exponential rise in the epidemic in the way it has happened. And when you get to that figure of 500,000, this was sometime now in March. So it has taken a few weeks to move from 100,000 to 500,000. But it has also taken now a couple of more weeks to take us to where we are. But as the world is showing an increase, China has started lifting its lockdown. Now I want to say here that we totally agree with the Director General of WHO, Dr. Tedros, that in fact there is a lot of good lessons to be learned in the way China managed this issue. This is not political, this is just scientific. It's a basic issue of there are things you do, a virus behaves the same whether you are in South Africa, in China, in the US, in Europe. And so we actually think that the leadership of WHO in this case has to be commended. They quickly moved to declare this a public health emergency of international concern. They also called on all the governments to do their best to deal with it. They have actually gone on to declare it a pandemic. So every one of us should have actually taken heed of that call. And whatever our circumstances are, we want to say that we support the Director General of WHO for all that the leadership that they've given. I want us to move to the next issue then, the next slide. Now this slide, all those colors, don't worry too much, but you will see two patterns in this slide. There are countries, a large number of them, who are showing a rapid growth of the infection, and that's the bunch that's at the top. And in that bunch you've got US, at the top you've got Spain, you've got Italy, then you still got China there, and then you've got Germany, France, UK, Austria, Canada, Australia. Now those countries are a kind of pattern which everyone has seen. This is how this virus behaves. And then lower, you've got other countries that for some reason have managed to keep the virus at a lower growth trajectory, which is Japan, Singapore, Hong Kong, a few others. Now, of course, when Dr. Tedros, the Director General of WHO, called us to a meeting, there were presentations that came from Japan, from Singapore, and then one from China and from South Korea. But that's the pattern. That's how this virus has behaved, and that is what I would like us to keep in mind as we go to the next slide. Now, if you look at those numbers, US, Spain, China, Italy, UK, all those numbers are showing where all of us were. When we started, if you look at zero, we start with the same pattern. The rate of increase on the first few days was at around an increase of 42%. For all of us. But what we have seen is something that is bucking the trend. and that is too early to talk about it. That dark line is South Africa. That line is already showing a possibility that South Africa can break away from the trend that everyone else has been seeing. Now, our advisors are saying this is an early indication that the lockdown has worked. That indication says we actually have two types of outbreaks that were going to be hitting us. The first outbreak was an imported transmission, where all the numbers that came for the first time, 100% of them were people who had actually either visited as tourists and were returning into South Africa, and then the others were tourists who came from countries where the pandemic was worst. Now, when the lockdown came, we basically stopped the importation of new cases. That means that no new infection would have come from outside South Africa in the European or Western countries epicenter. And in that process, all those who came from there, we asked them to be quarantined in their homes. Effectively, all we're saying is that no new infections come, and also we're saying that those who've got the infection must be isolated and stop them from spreading the infection until they burn it out in their bodies or they get treated. That happened. That means we've actually aborted the first immediate peak that we would have followed and followed the rest of the other countries. So you will see that the 10 of that graph is saying we no longer were able to follow the rest of the countries because we were able to act immediately and stop importation of cases. Now, anyone who would have doubted that there was a lot of sense in this decision should at least be now convinced. Now, that was going to be the first and a temporary problem, because as soon as we can stop those imported cases, we are going to get onto a phase now where we've got our own internal transmission. Now, in this case, we have actually again started disrupting the internal amongst our own. But the fact that you have seen a reduction from 40% increase to 4% increase, it means that you are now seeing a slightly different trend in the way this infection might be arising, which means South Africa, we did say that South Africa must learn from others, but we must chart our own path. It's beginning to happen that you will see now that it's possible for South Africa to buck the trend that the other countries are taking. This is still too early. That's the indication. We're just taking our South Africans into confidence on the discussions that are getting on around the scientific community who are observing this issue. It's important for us to share this, because when President Ramaphosa says lockdown, we need to know that there is an impact of that. Now, one of the things that would have really been a problem here would have been trains that are running with 200 people per coach, would have been taxis that would be running from area to area with people who don't know each other, coughing all the way. It would have been buses that are full of people moving from one area to the other. It would have been, big church groups, meetings. That's why I think we need to really take our heads off for the religious leaders, because it's a very sad and very painful. One religious leader said to President, well, it's the first time in the history of our country. And then the one bishop looked around and said, well, it's also the first in the history of the church. And I think we need to really say that South Africans have cooperated to actually make this fight a real South African fight. So now those conditions have actually helped us to reduce the rapid spread of the infection that would have happened if everything was as business as normal. Now, I think it's important to explain this, because we will still need South Africans' cooperation as we move into the future. If we go to the slide on the right. Now, the slide on the right is basically saying we have now parted ways with the countries that had a rapid spread, which are showing on the left, which is mainly the West. Then we are now trying to follow the countries that might have been successful. One of them is Korea, but you'll see that their graph at the top started taking a turn when they'd actually gone to, I think they'd gone to close to 30,000, I'll have to check, but they were able to turn the tide at that level. What did they do? They actually, or let me come back to that. Let's go to the ones lower down. Yeah, there you got Japan. Japan has maintained just 1,000 and something cases. And what we are now saying for South Africans, let's be ambitious. Let's be adventurous. Let's be very confident. Let's say as South Africans together, we want to part ways with the trend that we have seen in the West and in Europe. We want to actually follow the trend that we are seeing of the countries that have managed to stabilize. It has not happened anywhere. I'm not saying that we are there, and I'm simply saying that let's dream as South Africans. And yes, I think, yes, South Korea actually stopped at about 10,000, and they didn't, but they were the second fastest growing at a certain point. Now, I'm saying we as South Africans, if we can unite, if we can just follow the leadership that's been given, we actually stand the chance of moving from the fast spreaders to the slow spreaders on the other side. And, you know, to spread the infection, the example of Korea, they talk about patient number 31. There were 30 patients that were contained and there was no problem. Then came patient number 31, who attended a church service, going around greeting everyone unknowingly that she's got the infection, went around into the buffet, touching a cup and touching a plate and sneezing there and coughing there and shaking people, hugging that one, kissing that one, and normal social behavior that we all engage upon. By the time that conference was over, a number of people had been so infected that at a certain point in Korea, 60% of the infections were traced to one church. The issue is that you don't need many people to spread this infection. You need one person to spread the infection. And that one person can actually change can actually turn the trend of the infection. So far, with whatever limitations we have, you can see that there's a change now. Now, the reason why I'm pointing this out is that we must still expect a couple of peaks that will come. Internal transmission is slowed by the fact that there's a lockdown. But there are areas, in the areas where people are, that infection will not necessarily stop because people might not be adhering, and those who are infected will still be interacting and spreading the infection in small pockets. When we open up, those pockets are going to be exported to other towns and cities, and that's where the problem is going to come. The winter is coming. When the winter comes, it's going to show us that the numbers of people who are infected is rising. So, so we were saying we need to be keeping very closely to the observations. The scientists that are managing this issue have looked at this and said, could it be happening? So the only way, there are two ways of how they can check if it's happening. The first one is that to check whether in fact we have got people who are being treated but were not aware. In this case, they've tried to compare the numbers of hospital admissions. There has been indications in the Western Cape, as the epidemiologists showed me, but largely we haven't seen a huge number of an explosion on admissions, which means there are not many patients who might be going behind our back into the hospital and we are not aware of it. So the numbers, even if they are still not huge enough. The second one is that we could then be having too many deaths. So they went to check, and that the numbers of deaths are not necessarily showing a huge explosion. Now, for every country here, if you look at the worldometer, every country that's undercounting, you look at the numbers of deaths. It doesn't make sense. When you count, you shouldn't have the proven mortality rate is between 2 and 3%. So once you've got a country that's showing 10%, it means that the numbers of deaths they are recording is high simply because they might not have been counting properly. Those are the things that we are watching out for. And I'm just making the point now to say we now need to ask ourselves the question, how do we maintain this with the lockdown and without the lockdown? And this raises now a number of other issues. One of the issues that are going to be important Again, the President has covered this issue quite well, that the contact tracing has to be emphasized. In this case, we want to report that at this point, we've recorded 10,652 contacts that have been traced, and most of them have been found. There might be a few that are outstanding because there's always a lag in the numbers. That's the one issue. So the issue of contact tracing becomes important because we go onto the contact, both the one who's positive as a case and the one who is a contact, we need to go around them to test those people, screen them, check them if they've got symptoms, observe them, and then send those for testing. Right now, the President did say that we need to scale up the screening of patients of various communities. I did say that it's a slow start. At this point, in fact, when we consolidate the numbers we have of the numbers of community members who have been screened comes to 456,074 people. So that already means that's a good start. We need to escalate it to higher than that. So we are going to be talking to most of the provinces to move up their targets, and let's move up to the numbers. The other issue that we need to indicate is that we have actually involved a large number of tracers, and these are not standard with different provinces, but the total number of tracers who are now on the field, including the government staff as well as the volunteers and NGOs, it comes now to 13,488. So we're actually heeding the call that the President, the Cabinet, the NCCC has actually put on board to say let's actually push up the response. These are critical because we need to go and discover people who might be positive even before they come to our own centers. And this is coming very well. And I want to thank all our people for complying, and all of them, they've welcomed our teams. And there have been one or two instances where people have been frightened and they didn't open. And so we want to just call on them that when we do the screening, we would like everyone to cooperate. And if they do not cooperate, of course, it means that we now have to move to more enforcement measures to make sure that everyone is screened. So I would really want to appeal to everyone to cooperate. But numbers of tracers is now at the level of 13,488, and we want that number to continue to increase. The other one is that we've mobilized our community caregivers, our community health workers, and all those onompilo. The total number that's now being reconfigured to embark on this work is 57,272. These are figures that we've just been consolidating because now the Cabinet and President want to know how fast are we able to embark on this work. So we're then saying into the future, this is going to be one of our strongest weapons. Contact tracing, screening of the communities, and in the process, refer people for testing when they've got symptoms. That is what we're going to emphasize as we move into the future. The second issue that's going to be important is the social distancing. We need to get used to the fact that from now on, there's a new culture. No hugs, no kissing, no shaking of hands. Let's keep at a distance, keep at least at 1 meter apart, and if somebody's coughing, look away or use your elbow if it's you coughing, and so on. But in addition, we want that distancing needs to be now kept. And this must be now part of our new culture of how we want to keep that curve flat. And we think that the curve can be kept flat if people can keep on to these issues. It's already shown that it's actually beginning to work. And so I want to encourage that. The next issue is use of masks. So in addition to hand washing, sanitation, this issue of wearing masks is important. It's not one versus the other. It's everything together. And that's what they've done in Korea. That's what they've done in Japan. So we want to recommend now much more widespread use of masks. And in this case, we are recommending that people can use cloth masks. And cloth masks, we need to just try and make sure that there is a 3-layer kind of thing. So you can even use a handkerchief, which means all you do is you you fold this one way and fold this other way, those three together, that gives you already 3 layers, and then it can be turned into a mask. So you can use a handkerchief, but people can actually make their own mask. Just make sure that you try and keep those layers that way. The rest is a matter of fashion and fancy, but it's important to say now individuals can make their own masks. Small businesses can do their own masks and sell them, and so on. In other words, we would like to reserve the specialized masks, the N95 respirator masks, surgical masks, for people who are actually directly dealing with an intense infection in the hospitals, so that there shouldn't be a need or a requirement for everybody to go for the same mask, because we can see that the other mask can in fact can actually be useful, but also we can see that there are certain shortages because the whole world is looking for masks. I think when at the point when the lockdown opens and people are going to taxis, this is going to be one of the most helpful things. Taxis and big overcrowded areas, that people must now start using masks. That's a new culture that we have to learn. And by the way, all the cultures that people have had, they were actually developed because that's how they survived, and it becomes encoded into their mode of behavior. So there are critical supplies that we have to face in terms of the frontline health professionals that must use these masks. So our scientists are saying they've actually got evidence that anyone who's got COVID-19, if they wear masks, the level of the excretion of the virus in exhaled air after the mask is much reduced. And therefore there is evidence that with a mask we can actually protect the next person from getting the infection. And therefore it's something that we must now begin to work on as a culture. There are obviously certain guidelines we need to encourage people on. Firstly, that mustn't keep touching the mask all the time, and also that the idea to try and, as far as possible, to keep the mask on. When people are conversing in a conversation, they can continue with the mask on, and they mustn't necessarily remove them, especially if they've got cough and sneeze and so on. So it's important, but you must also know, you must treat the mask as potentially infective. So if you touch it, you must also make sure you wash your hands, and the mask must be washed frequently and so on. These guidelines, we will make sure that they are published properly, but we are basing it now on clear scientific evidence that we have, which is to say everyone should be now encouraged to wear masks, and that we can use the cloth masks as well. They're just as effective. We must just make sure that they've got the kind of layers that we spoke about, and then that the N95 surgical masks and so on will be reserved for the specialist settings where there are people who are making use of those conditions where people are actually dealing with a highly infective situation. Having said that, I just want to also report that we have had very successful meetings with the business fraternity, led in this case by Mr. Stavros Nikolaou. We have a whole group of teams, work streams of people who are involved in the pharmaceutical and medical devices and other health commodities, where because of the suspension of the anti-competitive legislation, we now can put everybody into the same house. As minister now, I can have access to a dashboard that can show me the stock of any item that I want to see, so that we know what is the country's readiness about in terms of availability of PPEs, the protective gear, the masks, the gowns and everything. We can look at that, and they've actually helped us to access suppliers who are available in China and India, so that we can actually order some of the stock. We indicated 2 days ago that a lot of stock is coming in, so that from Tuesday and tomorrow, Saturday, next Tuesday and Thursday, we're going to receive stock which, if all delivered, would actually give us a cover for the next 6 to 8 weeks in terms of the protection of our own staff. We have also looked at a number of other areas like pharmaceutical products where there's high priority, where we need to ensure that there's good enough stock ahead of time. We've also agreed to relax regulations to allow people to be given a large amount of a monthly consignment of their medication, particularly for chronic medication, so that over a period they are able to stay away from hospitals as long as they don't feel they've got symptoms. So all of that is work that we have done, and we want to thank the private sector for doing that. They sit down and they phone every country in the world to check where the stuff that you are looking for could be found, and therefore try and make sure that we can order together as South Africa. So that's how we're managing this process. We've actually been approached by the private doctors to say some of the costs of the masks are high. Can we help them to work together so that they can get it at a reasonable price so that they are able to get to supply themselves. So all of that work is being done. So that's the one kind of area of engagement that we have already had. The other one has been engagement with the unions. We met with quite a large number of unions in government on the health side. I've had 2 days of meetings. Some unions, I met them on Tuesday with in the presence of all the MECs and heads of department. The other lot, I met them on the Wednesday, and those were led by Nehau, and this was in the presence as well of the other ministers, Minister Patel, Minister for Trade and Industry, Minister of Labour, and the deputies who were all present at that level. So all in all, we were able to agree on one issue, that the protection of our staff is fundamental in the fight against COVID-19, and that no member of staff will be expected to go and work in a risky environment, in fact, potentially infectious area, without having the adequate protective gear. But that we will share the guidelines for the protective gear, because if someone is working in an isolation ward and treating someone who's confirmed to be COVID positive, doesn't necessarily need the same protection as someone who might be a porter or sweeping the floor or working in a particular section. There's a degree of protection that they need is not necessarily the same. So those guidelines need to be understood, so that not everybody must feel that they actually need the whole full gear of PPEs. That there's a lot of tension and anxiety that we need to work together to explain, so that we train people properly. Everyone is ready to be able to deal with the issues of protection. So we also looked at this, the availability of the stock, and the unions were able to see that, in fact, when we say there is adequate stock, in some areas there may be overstocking, in which case the regional leadership, the regional directors must look across and make sure that there is distribution equitably for everyone in that situation. They then were concerned that they want to participate very closely in the management of the COVID-19. We've agreed that we have formed already the Occupational Health and Safety Committee, which involves the public and private sector, as well as unions, which is at national, and we're going to be discussing with the MECs that we must have it at provincial and local level, so that they can discuss the issues. There's no need for us to have a confrontation when we could actually discuss these issues. So we've agreed on that, and we also have said that in the way we're dealing with these issues, the number of other matters that we've referred to the NCCC to deal with that were raised. All in all, the work, the meetings were very, very constructive, and we actually appreciate the cooperation of all that were associated with this. This afternoon or this evening, we shall be briefing the Portfolio Committee on Health, and in the course of it, we are going to be inviting this time around all MECs to be part of it, as well as heads of department, and we'll have an open discussion on all the issues that we're dealing with, just to make sure that all parties are on board in terms of what kind of work that has been done. I think all in all, we wanted just to give a sense of update as where we are, because this is now 2 weeks exactly since the imposition of the lockdown, and we want to say to fellow South Africans that the unity that's been demonstrated up to this point has really begun to show some green shoots, and it is possible that we might actually be able to buck the trend and can carve a different path for ourselves, which is important for us because our own conditions are very unique. We are able to talk amongst each other and consult. We're able to work together on common campaigns, but at the same time we've got underlying poverty, inequality, and challenges in the health system. So we really want to avoid getting to a point where too many of us are affected by the infection. Just to say, of course, it doesn't mean that this COVID-19 will go away. And it can't go away because it's here amongst us. But it also, all we are saying is that in the history of humans, to be protected from this kind of situation, you get protected two ways. Either you, what you call, you get an infection and you develop your own immune system against it. So next time the same infection comes, your body deals with it. And therefore, to protect a large number of people, everyone needs to develop that. Now, until you get the infection, you can't have the immunity. And that's it. The only ones who have immunity in this country are those who have survived the infection. Now, so everyone, it's not a contradiction, but at the end of the day, the sooner you get the infection and dispose of it, the safer you are from future infections of COVID-19. Let's face that, because we can't run away from the fact that this infection is here with us. The other way is vaccine. So if you then want to create a herd immunity, you then vaccine everybody, give everybody a vaccine, then even before they get the infection, their body begins to develop immunity against the infection. So when we talk about vaccine, we are actually talking about the only way that the 7 billion people can actually be protected. That's the only way. So I think we must always keep that discussion in balance. But just for now is to say that when the president made a call, we really hope that South Africans are going to follow the call of the president and then work together to try and contain the infection. Let me hold it at that. Thank you.
Thank you very much.
Thank you very much, Minister and MEC. We'll now take questions. You say where you come from and your name, and then we'll take first round. Can I see the sign of number 1? Are we all good? 2? Okay, if we only have 2 questions, then you can go.
Minister, I'd like to first start off with the insurance and investments. I understand that you said there will be an investigation that will be done by the provincial departments. What are the possible repercussions that the hospital will face? Also noting pending what the investigation shows, but there have been a number of nurses that worked there that had said there was a lot of negligence in terms of not having PPE. There's also a family in Port Shepstone that has stated that their father was admitted on the 24th of February after he had a second stroke. The hospital called them on Monday and informed them that he's contracted COVID-19 whilst in the hospital. The family has since tried to get an update on their father, and they've got no correspondence from the hospital. So they're not aware whether their father is dead or alive because the hospital is not communicating with them. The second one is around the issue of N95. There are a number of employers or essential service providers who have given them. Can you please clarify for how long can you use one N95 mask? Like you said, the ones that you can make yourself, you can wash. But around the issue of surgical masks and N95 for those employers who've given their workers, for how long can you use one mask? Thank you.
Okay.
Lord Khadeb from the CCTV News. My first question goes back to St. Augustine's. We understand that patients, some of them were moved to Kingsway Hospital. And there's a complaint from that hospital that some of the patients from St. Augustine's, they tested positive, and the staff there is worried that they don't have the PPEs in that hospital. What is the department doing in relation to that to try and prevent the spread of this virus in that hospital? Because it seems as if what happened in St. Augustine's is going to continue in Kingsway. The other question is that how ready is the province of KwaZulu-Natal in terms of, I did hear the MEC saying that they are ready, trying to communicate with the private sector as well. if maybe the MEC or the minister can just give us the number of how many beds do we have, because yesterday the Premier announced that there were 100 beds from the Ascot Park Hospital that will be used for COVID-19 patients. How many beds do we have in the province to try if this COVID-19 needs more patients to be admitted in hospital or in the facilities?
Okay, we'll then give it over to MEC.
All right. Thank you very much, Mlondi. I see you want to get the minister to respond to a question that we've been refusing to respond to you. Let me speak to the issue of beds. We've got our own beds as a province that we have put together, others that we have restructured, and others that we are working on. Now, we are going to announce, once we are ready with everything, on the total number of beds. And the reason why we've not been wanting to announce on them, it's because, as the Premier correctly indicated yesterday, we continue to engage with the private sector so that they also avail themselves or avail the beds that they can give us. Yesterday, the Premier spoke to 100 beds that we are going to be given by the JMH group. And that's just one. We have had another offer from the different groups, and that also was amounting to close to 95 beds that were available. Now, if you put all of that together, it goes to beyond 200 beds. We are continuously engaging with the other groups in the province. The engagement we had today, this morning, was also speaking to the groups to say, can they also give us the different beds that we could utilize? So the number will be more than the 200 that so far we have today. But if we could give you 200 today, tomorrow or in 2 days' time, our number would have gone up. But let me give you the different categories of beds that we are utilizing in the province. We have our own hospitals that will have a number of beds, and those beds will talk to those that we quarantine, those that we isolate, and the ICU beds. So we've got our own beds, and beyond the beds that we already had, as we have been indicating earlier on in the month, that we are repurposing some of the other facilities and hospitals that we have to actually give us more beds. And a very good and typical example is Clearwood Hospital, where we took one ward that was an open ward and we are converting it into cubicles. Now, out of that one ward, because of the spacing that we have to adhere to, originally they were putting 28 beds because it was an open ward. Now, when we convert and repurpose, we are going to get almost like 20 beds in one hospital. Now, out of that and out of that whole process, we will know for sure by the end of by the middle of which month is this? April. By the end of April, we'll be sure with all the hospitals that we have. I must say, Premier, Minister, that the days and the months have started blending into each other, so it's become a bit difficult to know which day we are on. We are in a lockdown after all. So by the end of April, we'll be sure on the exact number of beds that we have. However, what we are working on is 2,154 beds in the province, which will also include the repurposed beds. So that's the one category that we have. We have a hospital that we have in the province called, it's a new hospital, we've not utilized it, it's called Pixley Kaisaga Seme Hospital. Out of that hospital, we are going to get 450 beds, and that we will know by the end, or we might be able to utilize by the end of May. So that we will be adding. Now, that's why we've not been giving you figures, because we keep adding on the different numbers that we have. We have been given offers by the different sector on the beds that we could utilize, your hotels, your lodges, and some beds in the strict sense of the hospital beds, but we will be utilizing those as quarantine beds. And out of that, we've got about 700 beds so far, and we are continuing to engage the private sector in that is coming up and saying they are able to give us those beds. The third category of beds that we are having is a category that we are talking to creating centers that are outside of our ordinary facilities, and where we'll literally be creating your hospitals or your temporary hospitals. And we are looking at 2 centers in terms of the cities. We are looking at eThekwini and we are looking at Umgumundovu, where we'll be establishing or creating these particular centers. Now, when we say we are creating a center, in essence, we'll be creating a whole hospital outside of an existing hospital with whatever facility that we'll be utilizing. So as soon as we are ready, we will be able to report. But by the end of April, the majority of all these facilities will be up and running. We are as well considering options of utilizing temporary structures, and once we have been able to clarify that with the Provincial Executive Council, we'll be able to respond to it. So I think I've given you a bit more than what I wanted to give you on the bids, but it's a matter that we will be taking up with the Provincial Executive Council. The patients that are being moved or have been moved by St. Augustine, again, we are continuing to have an engagement. We have agreed with the facility, and this is why we still have one ward or one section of the hospital that is operational in St. Augustine. This is a section where patients have been tested. Some are still awaiting their results, so that once we know that they are negative, we are then able to move them to other facilities and other hospitals. And those patients that have tested positive, those we are not moving, they are going to stay in St. Augustine and St. Augustine Hospital and are going to be treated at that particular level. The patients that have been moved to Kingsway or whichever other facility are patients that we have tested and whose results have come back and said they are negative, therefore they can be moved. If there are concerns in these particular areas, we are going to engage with them and get a sense of where the concerns are emanating from. But you must understand that both St. Augustine and Kingsway are private hospitals that have their own arrangement. And in relation to the PPE that should be provided by these hospitals to their staff, it will come up out of that private engagement or private arrangement. However, as government, we have an interest, and as government, because of as government, we are given authority by the law to conduct inspections in the different facilities, and it's one matter that the minister has indicated earlier on today when we were having an engagement with the CEOs from the private facilities, that we are not going to be engaging or making requests from them to say, can we come in and inspect? We are going to conduct continuous engagements, and we are going to conduct continuous inspections in relation to the PPEs. So we will be doing that. We'll do the same thing with Kingsway, so that we are able to understand where is the level of their PPE and where are the challenges and where can we intervene. So we will look into that. We also have, and I think it's a question that will cover both of you, we also have a bit of a challenge in relation to some of our healthcare workers who work for government but are also sometimes conducting are conducting work outside of our own facilities, and you find them working in the different private facilities. We have requested from St. Augustine a list of the nurses that they receive through the agencies, because those nurses those health workers, you would often find that they work for the Department of Health, but sometimes they go and do the work in the private facilities. We are going to insist that we get that list, because if we don't do that, we might find ourselves being vulnerable or being exposed to our workers to our healthcare workers who work for us but also work for the private facilities. And if we don't know who they are, we then run a risk of exposure and a risk of the transmission from the private sector to our facilities. Mostly the health workers that we need are the workers that had worked for St. Augustine, because of course right now we all know that is where we have the biggest challenge, or is the hotspots in the province. So we are working on getting that list. There has been some indication that some of our nurses in some of the hospitals actually had done some work with this one particular hospital. We are investigating that, and we will follow up as soon as we have been able to get that list. We'll then be able to engage the different nurses, get their families, test them firstly, get their families, get their contacts, and then able to establish how far they have gone and how far they have gone in terms of engaging with everyone else. I'm raising this because I know that in Inkosi Chief Albert to the hospital, there has been a question of a health worker that is there that has been exposed. At this point, we are establishing whether that healthcare worker had actually worked for another hospital. There are indications that that healthcare worker actually worked for St. Augustine, but we are investigating at this point, and in about a day or two, we'll be able to come back to the media. But we have gone back to the hospital ourselves as government, now our own hospital, to establish how far this one nurse has gone in engaging, and we will be cutting the ties between herself and whoever she has contacted with and the patient, so that we are able to close down on that matter as soon as possible. Thank you, Minister.
Your questions have been answered. Let me just make a brief comment, and that is firstly that you're referring to a specific family. We can't answer that question. So when you finish this conference, you're going to give us those details. Just call them and find out what's the problem and see where we can help them. And at any one time, when media picks up information like that, send it to us, because we would want to check where we can help them. Obviously, there's a lot of anxiety here, but you can't have a father in a hospital and you don't know whether he's alive or not. It can't work. And so I don't know what is the problem, but we'll check it up immediately and take it up with them. The other point that I want to deal with is that we made a call that patients who are with St. Augustine's from the 1st of March must be recalled. They will be tested, they will be checked. Obviously, we're even discussing something else, and I'll say this just for sake of transparency, because I raised it with the thing that our clinicians are actually even suggesting that we could probably take certain samples which will stop, and then when some of our immunoglobulin test kits come, and then check, so that we are able to find if those people who are negative ever got exposure to the infection and they've healed and recovered from that. So we are going to look at all possibilities of it. But it doesn't matter where people are admitted, we will be able to track them, all of them, so we know what's happening. And we will then also follow those hospitals where there have been new transfers and new patients. So we are following that matter as it were. The question of what are the repercussions, there's already been negligence. We don't work like that, unfortunately. We don't cast aspersions before we get to the investigation. We have a proper professional investigation, we get findings, then we act. But to come and give a general statement will be misleading, because we don't know what we're going to find. And when we give you such a response, it's very much likely going to be distorted and therefore create a wrong impression. So let's agree that we will investigate and take the necessary action which we will announce at that time, so that you don't feel worried. What repercussions there are, we're working with a lot of cooperative attitude with everyone, including the private sector. So we don't anticipate that there are things that we will want them to do that they will not do. We haven't come across that yet, and we don't think it's going to ever happen. But then if there are actions that need to be taken, they'll be in terms of the law, and those actions will be done in such a way that they are to help to correct the situation. And we want to make sure that we follow the issue very professionally, and we will not announce here what might amount to threats, because that's not how we work. How we work, we follow the law and we follow the clinical guidelines of how every situation is made. There are clear guidelines of how you deal with this. It's going to be followed like that. So I haven't got a problem. If there's any need to take action, it will be taken. And there's no favor, no fear. We'll be able to deal with it like that. It's important just for us to say that the engagement is to make sure that there's no negligence, there's no undue exposure of our staff members into a risky situation where they are not protected. We never can allow that. We want to make it very clear that no one must be allowed to put pressure into our staff without protection or training, put them in a situation they can infect themselves. That's not allowed. The confidence we have in our system is the professional training of our own staff, where we know you can walk into a place with someone who's got COVID-19, who's got Ebola, who's got everything, you can treat them and get out and not get infected. That's our pride. We want to keep that. And so we will not allow a situation where anybody gets stampeded into an action out of fear and then they expose themselves. The professionals know if you have a particular line of protection, if it breaks, you report, because there are certain implications there. And therefore, they must therefore be always acting with the best of clinical and professional judgment that they've been trained to. So that's really how we defend our staff. And in this case, there need to be an understanding that every professional is actually a leader in their own right, and they will not be allowed to do things that they believe professionally and ethically is unacceptable. They actually have a right to rebel and say no. And when they explain, we will be able to say, for this reason they were right. This and this will be done to make sure that they're protected. So I want to be very clear on that. You can't defeat the COVID-19 if you can't protect the soldiers who are in the forefront. That's the point that I think we must be very clear. That's why we had a clear understanding with the union that there can't be a difference between us. The people who must be protected are our staff. The people who are going to be in the forefront of dealing with this thing are our staff. They can't be put at risk, but they can't fear the COVID-19 virus. We are trained, it's like the army. The army can't say the other fellows are shooting. You are trained to face the bullet, and you know how to deal with it. In this case, these are professionals. They are trained to defeat the infections. They are trained to defeat the COVID-19. They are not fearful. So what we need is to make sure that when there's anxiety, it means there's unequal training that we need to invest in. And therefore we've said they must raise the issue, so we must go and check what is the problem. So in this case, the necessary investigations will be done. The question about N95, it just depends what's happening there. Most of the time, if you're wearing it on a precautionary basis, you can keep it longer. But if you get yourself exposed to an infective situation, you drop it as soon as you finish with that issue and throw it away. There's a clear protocol, so I can't give you all the protocols. There are different circumstances of how you deal with them. And there are instances where you would say, if you walk in, you use the mask, and then as soon as you get out, you drop the mask. But there are instances where you can keep the mask longer even if you're in that place, because you have not yet to interrupt your routine, and so on. Then also, depending on the level of infectivity of the case you're dealing with, you might then be asked to do it every so many hours because of the concentration of possibly the pathogen in the atmosphere that you need to be preventing. So you can't give one line. But when you deal with the public announcements in terms of power, we'll give some guide that will help people to understand as to what's happening. So for example, someone has got a very infectious cough and a roaring infection, you shouldn't be keeping that mask for much longer, maybe more than 2 to 3 hours, if that is the case. But we don't know what the situation is, so we need a broad guide. So there's no answer you can give and say this and that. There are different categories and different circumstances. Thank you very much.
Thank you very much, Minister. You see, there was a slight request for the Burundi someone.
Okay.
I'm Berlin Strauss, Miss South Africa.